Hello, good morning everyone. Today we'll be discussing another multiple choice question that was asked in the aims 2019 PG entrance examination. So the question was that band-shaped keratopathy is seen in what condition? The options were hyperparathyroidism, uveitis, corneal edema or none. So the answer was hyperparathyroidism. So now let's learn something about what exactly is band-shaped keratopathy. This is the clinical picture that you can see in a patient with advanced band-shaped keratopathy. This much part of the cornea is involved, and also there are cavitations. You can see these are the cavitations here. These are the microcavitations. And this brown, these are the pigment deposition. So this is band-shaped keratopathy. This is another picture of band-shaped keratopathy showing a large amount of calcium deposition in the cornea in the interpalpebral area. So you can find any of these type of picture in the examination or in your clinical posting. So this is a spot diagnosis of band-shaped keratopathy. See, it is basically a degenerative condition. Okay, what happens is in the Bowman's layer, a cornea has 5 layers: epithelium, then the Bowman's, then the stroma, the descemet, and the endothelium. Up below or above the descemet, there is a pre-descemet layer or the Duas layer. So in the Bowman's layer or in the epithelial basement membrane and in the anterior stroma, there is deposition of calcium salts, and this causes the development of band-shaped keratopathy. Now causes are, there is chronic anterior uveitis. Not all uveitis will cause band-shaped keratopathy. It should be chronic and mostly occurs when the uveitis develops in children, in phthisis bulbi, and in chronic corneal edema. Important thing to notice the chronic corneal edema, because in the MCQ the two options were uveitis and corneal edema, but not acute or short duration. These pathologies can lead to band-shaped keratopathy. They should be chronic in nature. It can be age related or it can be metabolic. Metabolic results in metastatic calcification not only in the cornea but other parts of the body as well. They should the what they what happens is there is increased serum calcium and phosphorus, and we all know that when the parath hormone is increased in a condition called as hyperparathyroidism, there is increased calcium in the body, that is hypercalcemia. Also in conditions like hyperuricemia and CRF is chronic renal failure. There is metastatic calcification. So how it progresses? In the first stage or in the initial stages, there is peripheral interpalpebral calcification with clear cornea. Now, clear cornea means that if this is the cornea and this from the periphery, this is the generation of band-shaped keratopathy. This part of the cornea is clear, means there is a clear zone between the band-shaped keratopathy and the limbus, right? Then what happens is there is gradual central spread. These things, it begins in the periphery and then it spreads towards the center, right? There is gradual central spread and then it becomes nodular and even elevated, and sometimes it also develops cavitations. Now this is the initial stage. This is the clear part, not clearly seen, but this is the clear part. It is developing in the interpalpebral limbal opacification. There is a clear zone. Then what happens is there is this central spread. You can see that this part of the cornea, that this much part of the cornea is not being affected by the calcification. So this is the clear area, right? There are also small minute holes like you can see here, this or this. These are the small minute holes with the calcified area. Now what coming on to the treatment, we can do chelation. Chelation will precipitate the calcium salt and then they will go off. So chelation is done with EDTA, 0.01 molar EDTA. We can do phototherapeutic keratectomy in this. This is the cornea. There is this band-shaped keratopathy. This is so with the help of laser or something, this area is scraped off. this area is scraped off, and then the new cells which will take over or which will cover this area will be free from the calcium deposition. If it is too hard to manage, we can go for a corneal replacement or the keratoplasty. And the important thing is that always treat the underlying cause. If it is uveitis, treat it. If it is parathyroidism, treat it. Okay, so that's all for the band-shaped keratopathy and the discussion of the question that was asked in aims. So keep studying.